Hey everyone, and welcome to this editorial edition as part of the Labonyx Bltztorm. This is a Bostix news, a cavalcade and path slide, and another Storm Bostix production. As part of this the Labonyx Bltztorm and this editorial edition, this overview will be in around transplant immunobiology, looking at chronic kidney disease as as a review, and we're in this was collaborative works between colleagues in aligned to three academic institutions in the United Kingdom, sort of retrospectively between 2000 and 2000 between 2010 and 2013. There has been an audio podcast in the Storm Robotics Productions as part of Storm Robotics Production, sort of in a sort of previous in a previous a series where the full perspective, full sort of overview around this is given. It has been provided, but however, I thought this works having this works accepted for presentation in the within in the remit of the International Pediatric Transplantation Association, or IPTA 2023. This works I thought it would be an opportunity to share as part of this editorial edition the an abstract around this collaborative works. And so in around the background, so patients having CKD, or who are diagnosed with CKD or chronic kidney disease may be compromised owing to restrictions across pathophysiology and immunological paradigms. The CKD patients live with the threat threat or impairment of functioning, such as lack of energy and impaired cognition. Those in CKD, for example, severity stages 4 and 5, can have consequences across several dimensions which transcend pathophysiological abnormalities. In around the aims and objectives of this works aim to outline the central mechanisms in around CKD, chronic kidney disease, and in around the mechanisms, aspects of mechanism, and Selye's theoretical propositions and empirical findings provided sort of the principles used in coping, utilized in around coping and stress research, and has been often cited as scientific and clinical basis regarding both the General Adaptation Syndrome from 1936 and the Biopsychosocial Model in 1977 by George Engel. In around this at the same time, hypothalamic-pituitary-adrenal axis, or HPA overactivation, occurs during times when patients undergo stressful or challenging situations, and this can potentially affect T cells and markers through immunosuppressive effects of the glucocorticoids. In around some of the conclusions of this works, so linking sort of the endocrinology such as cortisol, adrenocorticotropic hormone, or ACTH, and cytokines may prove advantageous in prospective investigations, and further, patients with CKD who have in sort of intense periods of duress or stress and having to utilize resources, this may have specific effects regarding to immunological components of immunological components and neuroendocrinology. For example, in CKD patients undergoing different forms of renal replacement therapy or RRT, laboratory investigations are required to explore how particular immune and neuroendocrine neuroendocrine cells are promoted surrounding tolerance in CK in the CKD or chronic kidney disease population. In around sort of terminologies around this works, terminologies physiology in around the terminologies physiology, chemokines, endocrine, immunology, and chronic kidney disease (CKD). So there will be some resources in the information in a link to social media as part of this as part of this sort of overview, as part of this editorial edition, in on again in on social media. So listeners can so listeners are welcome to check out the sort of information in the descriptives on social media to find out more around, for example, the literature in around this works so thank you for tuning in. This has been an editorial edition as part of the Labonyx Bltztorm, as part of a Bostix news, and part of a Cavalcade and Pass Night and another Storm Bostix production. Thank you.